So I think many of us feel that ctDNA monitoring right now is a useful tool. There are still important questions that remain in order for it to be truly utilized in prime time. I think further work is certainly needed to better understand how the location of metastasis, where the metastasis is, and how that might impact shedding of ctDNA is important, particularly in melanoma, where we know that many patients may have subcutaneous disease recurrence, nodal recurrence, or even CNS recurrence, where perhaps it's harder to detect circulating tumor DNA. And for that reason, we really are going to need improvement in our technologies to improve the sensitivity of these assays, but we need to do that without in any way impacting specificity. We really don't want to be riddled with false positives in this space, which then can confound our treatment decisions and certainly worry patients. I think when we're trying to understand how to improve sensitivity, there are a few potential options. First, we can really just try to expand the number of mutations that are available for monitoring with technology such as whole genome sequencing. And I think one really interesting thing that investigators are also looking at are ways to alter ctDNA clearance. So there's actually just a fascinating paper that was just recently published in Science, and it demonstrated the potential role of priming to attenuate ctDNA clearance and therefore improve our ability to recover ctDNA or identify ctDNA and thereby improve sensitivity. So in this work, investigators used 2 intravenous priming agents that were given about 1 or 2 hours before a blood draw. And they were aiming to act on the known mechanisms of ctDNA or cell-free clearance. 1, uptake by liver resident macrophages, and 2, degradation of circulating nucleases. And by using these 2 agents and acting on those 2 mechanisms, they were hoping to enhance ctDNA recovery. And they found that. Again, this was in preclinical models, so something not yet tested in humans. But with these types of approaches, they were able to improve their ctDNA recovery by more than tenfold and enable more complete tumor molecular profiling for ctDNA. And then specifically when they were looking at small tumors or tumors that were potentially in more challenging places to detect ctDNA shedding, they saw sensitivity for detection improve by more than 50%. So I think we have very smart scientists looking at this question. We have a lot of invested investigators hoping to improve sensitivity in this space.